Community-based coordinators will now be tasked with monitoring compliance for the home-based care program launched by the Minister of Health Wednesday, following increased number of COVID-19 cases in the country.
We are glad to inform you that today we are launching our home-based isolation and care guidelines for patients with COVID-19. This guideline is available on the Ministry of Health website.
Eligibility for the home-based isolation and care for patients includes laboratory-confirmed COVID-19, asymptomatic patients or patients with mild symptoms of COVID-19, absence of comorbidities, as well as access to a suitable space for the program. The decision to care for patients at home will also require careful clinical judgment by a doctor.
According to the available data that we have, 78% of infected persons, that is, positive cases, admitted in our hospitals are either asymptomatic or mildly symptomatic, and therefore can be managed at home, provided proper laid-down procedures are followed.
At the same time, the country has recorded the highest number of COVID-19 recoveries after 175 patients were discharged from hospitals, having fully recovered, bringing the total number of recoveries to 1,048.
We shall be failing if we do not recognize the good work of our healthcare workers, whose effort and dedication has made it possible to record these many recoveries.
Coronavirus cases, however, surpassed the 3,000 mark Wednesday after the Minister of Health announced 105 additional cases, bringing the total number of infections to 3,094.
96 are Kenyans and 9 are foreigners. 77 are males and 28 are females. Nairobi with 43, Busia with 18, Mombasa with 11, Turkana 7, Migori 6, Kwale and Kiambu 5 each, Kilifi, Machakos and Taita Taveta 3 cases each, Kisumu 2, Uasin Gishu, Siaya, Kajiado and Garissa 1 case each.
Health Chief Administrative Secretary Dr. Rashid Aman said the new infections included 96 Kenyans and 9 foreigners, the youngest being a 2-year-old. The oldest patient is aged 77. Despite most COVID-19 patients in the country being asymptomatic at 78%, the Minister of Health warns it's dangerous to assume things will remain the same as more complications of the virus could be witnessed in the coming days, and urges Kenyans to strictly adhere to guidelines on COVID-19 prevention. Purity Museo, Channel 1 News, Nairobi.